Ladies, welcome to another self-love conversations. My name is Gloria Ward. You know, I only bring you the best in our field to talk about different things. And today we're going to talk about managing our mental health through self-care with the amazing Dr. Rachel M. Wilson, who is a speaker, a minister, who does a lot of work in her church, who is married to a pastor, who does all of this stuff to make sure that she is taking care of not only herself, but also the people in her community. And I am so glad that she's here because now she gives us some tips and tricks about how we could go ahead and take care of ourselves. So, Dr. Rachel Wilson, thank you so much for being here.
It is my pleasure. I'm happy to be here, and hello to everyone out there that's listening as well.
Absolutely. So, my thing, Dr. Rachel, is when we talk about mental health and then we talk about the church, it seems like it's two different dynamics, right? At least from the outside looking in,
Mhm.
right? Where it's hard to say what it is that you're really going through if you are in an environment where you are supposed to rely on something higher than you, right?
Mhm.
We did this big series called Sisters How Y'all Feel, Brothers Y'all All Right in February, right? And one of the things that our brothers said is that my father abandoned me when I was young, right? And my mother would tell me to go and pray to my father, right? And I just told her, okay, I'm growing up with a father I can't see, and then you want me to pray to a father I can't see. So how am I supposed to balance myself? How am I supposed to balance my mental health? When you hear something like that, because I was sitting up there like, wow, I didn't even think that you can go ahead and, put that stuff together.
Mhm.
When you hear something like that, what are some of the things that, come to your mind? Because most of the time, that's how a lot of people feel outside the church.
Absolutely. Well, first of all, that is an awesome question as well. And I most certainly can relate with not having a natural father raise me. And so
Hmm.
that's our first foundation is our parenting.
Right.
And when our parenting foundation is ripped apart, and then we're trying to add the spiritual when there haven't been the natural, many times and oftentimes that could be a hard thing to digest. You know,
Right.
it can be rejected or we can retract. It's easier for us to be susceptible to retract back from something that we didn't know naturally. And
Right.
so I didn't have the natural father, but I was raised up in as a Christian, a young Christian lady. My mother was a Christian family, raised up in church.
Hmm.
We were taught how to respect and honor the higher power.
Right.
And so it was just what we did. We were learned, we were trained, we were shaped into just learning how to honor God. And that's a good thing. But it can be oxymoron when you're going home to no father. It can be
Right.
on it's we I think the majority recognizes something higher. I personally believe even the atheists recognize there as a higher power. They may
Right.
not say God, they may not honor it, but if everybody obviously know we didn't create the sky, we didn't create the moon, it has to
Yep.
be something higher.
Right.
But
Right.
we believe in Jesus and we know God. We believe in, those two are one.
Hmm.
So with all that being said, for myself, I don't want to say I necessarily struggled with the spiritual side, but I do understand those that did or do.
Hmm.
I do understand
Hmm.
those that are may struggle with. I don't have a natural father now. I got to respect a heavenly father.
Exactly.
I'm not against that because it can
Hmm.
be him. It could be a struggle. Mine wasn't so much a struggle with the spiritual father because I was raised up in that soil and environment that cultivated my mind and shape. There was a shaping mechanism that taught me respect and honor. But I
Hmm.
suffered very, very badly on the natural, not having a natural father. So
Yeah.
it can be as you previously stated, it can be a struggle. And I'm not here to basically say it's wrong or right, because we should, honestly, we all should have respect and honor to God. But who am I to say it's wrong to struggle in that area, because I'm not the person suffering with a natural father.
And I'm so happy that you said that, because it was something that a lot of us couldn't answer, where it's like, okay, I'm out in this world and I'm trying to figure things out. And his whole point at the time, and most of the women listening, is that, I'm trying to figure out what my life is like, and I'm trying to figure out what is considered to be me. And, Dr. Rachel, we're in our 30s, 40s, 50s, 60s. So it's not like it's, your 20s and you're given grace to go and figure it out. And then, right, you have created this whole life for yourself,
Mhm.
and you either got married, you have kids. And so now there's something gnawing at you saying, you know what? I don't know if this was right. I don't know, like what's going on with me. And now it's this whole thing of, well, I don't even know if I'm depressed because I've been in this state for so long, right? And even if I do go out and I go to church and I come back or whatever, right? I do have faith sometimes, but
Mhm.
I don't know what I'm feeling,
Mhm.
right? How, for a woman who's listening, who's battling with her feelings as to if she's going through something, mental, or if she's just in her state where she's trying to figure out, how do you start to figure it out? Because a lot of people don't know, Dr. Rachel. It's like it's so routine, if that makes sense.
Absolutely, they don't know. And
Yeah, it's so routine. So how do you start to separate that? Because you coming home, you yelling at the kids, you don't know why. Your husband want his girlfriend he had, and you too tight, you know, and you want this, and then it's like, no, what is wrong with me? Why am I so tired? Why I don't like this? Why am I snappy? And you don't know.
well, one of the things, it's okay um, if you don't necessarily know how you're feeling or why you feel bad, but you have to literally be able to name what's going on with you. So, like for example, if I'm feeling sluggish, I need to highlight that, whether it's
Yeah,
on paper or in my mind, to say I'm feeling sluggish. That's something that need attention to, whether it's
yeah,
a vitamin deficit, whether it's something hormonal imbalance, chemical imbalance. I would not encourage anyone listening to just move forward with a deficiency, because you don't know, but you need to at least name. You have a right, as a human right, to at least identify what's going on with you. That's the first thing. So you might want to get some notes. You want to write identification. Identify what's going on with you. I'm feeling sluggish. I'm feeling sad all the time, and it's not, and nobody didn't die or nothing's happening. I feel hopeless. These are things you need to at least identify these things first. After you've made a list and have a clear understanding what's going on with you, you can look at it and see, this is really going on with me. Then what I want to do is encourage you. Of course, first and foremost, God is first in my personal life. And I
hmm,
recommend that to anyone that is listening. God should be first in all of our life. And it is a
right,
decision, it's not mandatory. You can do what you
right,
feel to do. But I always put God first, because that is, again, the source to everything that we're doing. That's just respect and honor for his earth, his breath, and who he is as a person. And so we honor God first. And then next, I would say it's okay to go to a doctor. A lot of things have become so taboo in the church, and God is now allowing it to unravel in Christendom, where we're now talking about
absolutely,
therapists, we're talking about psychiatrists, we're talking
yep,
about marriage counselors, believe it or
yep,
not. We're talking about things that we need, psychotherapists, because God created the organ, the brain, and he meant for, just like when he created the woman ovary, we go to a gynecologist for that.
Sure
Well,
do.
there are people that are brain surgeons. There are people that helps with the brain, the anatomy of the brain, to help you function better. And many times, and oftentimes, the way I grew up in Christendom, we came against the brain. We said
Mhm.
it was a demon,
Yeah.
or something's wrong with you. And we made people feel uncomfortable, to feel like they could not come to a leader or a ministry and feel bad. We felt like everything was the devil, everything, the
Yeah.
devil's
Yeah. Yeah. Yeah.
the devil, how to come to prayer. But
Yeah.
I know this sounds really, really weird, because we always need prayer. But sometimes at that moment, we know prayer is good, but it is great and it's always needed. But
Hmm.
at that particular moment, prayer was not necessarily the thing they needed for that moment.
Exactly.
They have a chemical imbalance, they have a deficiency, and they may need a vitamin. They may need
Hmm.
vitamin D, B12. They literally just may need a therapist to talk to vent about the rape, or vent about the divorce, or vent about the cheating, or the hurt, or the pain, or the loss of a child. It wasn't so much a spiritual thing, even though we know spiritual is connected to all things. It was more so just venting. And so
Hmm.
I believe, and I do see God compassing even Christendom and the church back into a healthy balance. It's not
Yeah.
anything wrong with a therapist, but a therapist will never trump God. We should not
Yeah.
honor a therapist over God, but a therapist is a tool to help us heal. It's a
Yeah.
tool to help us come in balance and become even as a person. God
Yeah.
said, His word, I wish above all things, beloved, that you would prosper, be in health, even as your soul prosper. He wants us balance. And so that's
Hmm.
what I would like to submit today, is just, it's okay if you don't feel good. We're validating your feelings, but you need to get some help. It's okay to get vitamins. It's okay to,
Yeah.
some of you right now that's listening, get a doctor appointment, go get checked out. It's not always, I need to get prayer. Yes, you should pray. We should always
Yeah.
pray. The Bible says we should
Yeah.
always pray. But he put us on the earth. He put doctors on the earth. He put
Come on.
gynecologists.
That's
I mean,
right.
we have women have to have a gynecologist. We have
That's right.
what do you call them? Colonoscopies, all kind of stuff
Yep.
that we have to get done
Yep.
because we have a physical body, we have physical organs that have to get
Exactly.
checked out by doctors. And so don't eliminate the natural as well as the spiritual.
Man, that just sounds so good to me because I'm like, we always say God is in all things. If He blessed their hands to go ahead and heal you, why not? Right? He did
Uh-huh.
it in the Bible, right? You had prophets, you had teachers, you had a whole bunch of people who did different things and looked differently, lived in different places. So the lesson in that is that make sure you don't ignore what's in front of you, right?
Yes,
Because
yes,
if I went and I healed and I healed this person through someone, that person might be your doctor, that person might be, your therapist or someone where I'm giving them the divine intervention to speak through, through them to you, right?
yes,
So we have to see this thing as, God is in everything and He is everywhere, even in that little vitamin, even in that little stress ball you holding, even in that little rock, right?
absolutely.
And when it comes to mental health, with the way that is running rampant right now, where, it's becoming this buzzword and everybody is focused on it. When we talk about self-care, I want to know what you think about that too, because I mean, in my opinion, Dr. Rachel, I don't like when people when things become a buzzword that is so important like that, because then it gets watered down,
Mhm.
right? Where people say, "Yeah, I'm doing my self-care, I'm going to the nail salon, I'm doing this, I'm doing that." And I'm like, to me, you have to look at the real self-care that you need.
Mhm.
Like you said, good nutrition, prayer, meditation, sleep, right?
Mhm.
All these things, fasting. That was considered to be the self-care because that really rejuvenates the body.
Mhm.
Wouldn't you agree?
Absolutely. It is. self-care is like, it is a plethora of, it's such a large room, and there's so many things that come under that umbrella. It's a wide spectrum, if you will. It's a wide
Hmm.
spectrum. So a lot of people just see it as getting my nails done. That's
Right.
amazing. But this is
Hmm.
surface stuff. This does matter.
Yes.
You know,
Yeah.
your oral hygiene and all of those things really do, believe it or not, it shifts the chemicals in your brain. And happy
Yeah.
hormones is something about just the anatomy of a body to keep it clean and to have a, good teeth cleaning. All of those oral things are amazing. However, that is surface. But
Hmm.
if you really, really want to go deeper, there are deeper levels of self-care, and that would go into how we think,
Yes.
being able to protect our thoughts. Because, again, we want to honor everyone out there, because I know everybody has been touched with some type of mental health disorder in some type of way. It's like all exclusive. If you're a human on the earth, you
Hmm.
have been hit. So we have
Absolutely.
all been touched in some type of way, in some type of emotional disorder, something that's hit us in the mind, because that's where our primary functionality comes from. And so, with all that being said, in the mental faculties where we're all at, we have to literally be careful, because we need to, again, protect our mind. If we're talking about mental health awareness, this is the month of mental health awareness, and it's coming to a close. But even after
Hmm.
this month come to a close, we will forever have that problem on the earth, because it's
Yeah.
all something hitting us mentally, psychologically, traumas. And even if we don't get a personal trauma, we get indirect traumas through watching the news, seeing our family suffer
Exactly.
with cancer. It's always something that's hitting our mind and our mental faculties. But that self-care with protecting our thought life, protecting how we think, what we think about, what we watch, what we're ingesting through television, it really
Hmm.
does shape and reshape the mind. So we have to be careful on that. Now, that is just a protecting of the shield and protecting of the mind. But then if we even go to the third level and even get any deeper with self-care, how about forgiveness?
Mm.
Ooh, oh my God. This is some, ooh, this is like open heart surgery now.
Hmm.
Oh my
Hmm.
goodness. So that open heart surgery connected to the will of a man would be connected to that mind piece. Like forgiveness, some of us, beyond getting your nails done. Trust me, I believe in all. I'm a girly girl. I love makeup, lashes, false lashes, hair. I love
Yes.
all of that stuff. But the real, true, deep healing, if you want to go deeper, who do you need to forgive? Who
Mm.
in your phone right now? For some of you just listening, you have a phone just like I have a phone, but who's in this phone that need to be removed? This would
Ooh.
drastically help your self-care, because you have negative people in your circle. You have people that is giving you information that is not good. They're telling you what you can't do rather than what you can do. And so eliminate process of elimination helps the mind. It helps you. It's a self-care at a deeper level. But a lot of
Hmm.
people don't want to do that type of work. They just want to
Right,
go get
right, right.
let me just go get a pedicure, get a massage. Amazing. But when are
Hmm.
you going to massage that forgiveness?
Mm.
When are you going to massage that, get that hatred out of you? That not for,
Hmm.
I went through, I look like I'm a really nice person, and I think that I am.
Hmm.
However, I had some self hatred in me. I have to be honest,
Yeah,
as a Christian, I had a lot
yeah.
of bitterness, anger
Hmm.
in me. Um, People that had hurt me. I just had this little
Hmm.
darkness, bitter area in me that I just
Yeah.
could not forgive them. And
Hmm.
I'm coming from the post, healing. Like I'm in my post, I'm in my healed season, but there was a season where I had unforgiveness, and it was
Oh
killing me.
yeah. Oh yeah.
Joyce Meyer says it's like drinking poison, thinking the person that hurt you gonna die.
Yep.
But really, if
It
I
is.
drink poison, I die. And so
Hmm.
the internal self-care is where I want you all to really just think about some things. I believe our job and my job is done today if I can just get you thinking and saying, you know what? I know I got my nails done today, but when am I going to work on that forgiveness?
Yeah.
Yeah.
Yeah. When am I gonna be grateful for the things that I have? instead of looking at the things that I don't have and
Yes.
asking God why I don't have them, right?
Hmm. Hmm.
Because and I tell the women all the time, gratitude is like healthy more. When you put yourself in a space of gratitude, you are already thanking God for the things that you have. That's why he say be a good steward over the things that you have so that you can get the increase. Are you doing good with the things that you have in your hand? Right?
Mm, that's good.
And when it comes to that, that jealousy, which is a mixture of fear and anger, in my opinion, you afraid that something is going to go away and then you angry about it. It's like, that's you have to be able to pour more into yourself and know who you are, because that jealousy is there because you're afraid something is going to be taken away from you, right? Something
Yeah.
that you think is yours where we don't own anybody. Right? We
Yeah.
don't own anybody. People are free to do whatever it is that they want, as long as it doesn't infringe on the life of somebody else.
Absolutely.
My grandmother used to say, freedom is a two-way street.
Hmm.
And as long as you can, do what you do, you got to understand that a person can do what they do, but you got to be filled up first, right?
Yes. Absolutely.
And when it comes to self-care, uh, one of the things that I do is I fast a lot, only because I know, like what you said, that's the inner workings of me. Like, I don't get my nails done. I don't really do too much of that. But when I know that life is out of order and things are crazy and my mind is not, fasting is the best thing for me because it's a reset.
Mhm. That's good. That's good.
Right? It's a reset. And being in a situation where you are removing those things that you said distract you, you
Mhm.
get to see really what you dependent on and
Absolutely.
why you dependent on those things, and it gives you clarity, right? So I want every woman that who's listening now to understand what Dr. Rachel said. It's like you the outside is nice, getting your nails done, going to the spa, all those things. Those things make you feel good for that moment. But the true self-care and the true mental healing is doing the real work, which is the forgiveness, which is having that gratitude, which is letting go jealousy, which is setting boundaries, right?
Absolutely. Yes. And I like to encourage, I think that everybody, we know God naturally is a God. He said, I'm a jealous God. There should be no other God before me. His jealousy was like a healthy jealousy. Um,
Mm-hmm.
Wife should be per se in a healthy jealousy. I don't want another woman, my husband getting attention of
Mm-hmm.
that's a natural, healthy jealousy.
Yes.
Then to be jealous of somebody you don't know because they look better or they're doing better, all of
Yeah,
that is mental and psychological. And
that's right.
so all of us have probably dealt with that some type of way in our life because we all have been hit mentally. But what has helped me shift to that many, many years ago, the Lord began to deal with me with my personal life. And when
Mm-hmm.
he began to deal with me, as you were saying so beautifully, with my personal life and things
Mm-hmm.
that I need to deal with, I got so consumed into just trying to work on the things God was dealing with me. I didn't have time to compete with anybody else or to
Come
be
on.
jealous or to compare myself. I'm like,
Yep.
I'm still trying to work on my attitude, or whatever God is dealing with me at that particular season or time. I'm so focused on my me trying to be the successful individual that I need to be on the earth to glorify God. Not that he don't love me, but it's just that there's some things I want to be better in. I want to be more respectful, more educated, or just being a better me, being a better
Mm-hmm.
me. When you focus on yourself in a godly way, I'm not talking about in a narcissistic, because
Right.
we're in a generation now in the 21st century, it's a very narcissistic geared and compass generation that everything is about themselves, that they
That's
overlook
right.
they don't respect their mother, they don't respect teachers, they just become a narcissistic, they just get themselves fixed up to become images but not really servants anymore. So I'm not talking
Come
about
on,
that,
Dr. Rachel. Mm.
narcissistic. Yeah. I'm not talking because some people are like, oh, I take
Mm-hmm.
care of myself. I get my hair done. I put $300 in my hair,
Mm.
but
Nope.
you do not, you don't tithe, you don't sow into communities, you don't care about anybody but yourself. That's not the
Yeah,
type of self-care we're talking about. That's beautiful that you take care of yourself, but you have become your own idol. You're your own American idol. We're not pushing you to make yourself an idol. Now, God does, that's what God is jealous of. He don't want us to worship
exactly.
ourselves. He don't want us to be
Mm-hmm.
narcissistic in what we're doing. But I'm simply saying, take care of yourself.
Mm-hmm.
But let's also remember that the inner healing and the inner health is even deeper, because some of us
Yes.
are angry at an ex. This ex, this was so long ago. This is doesn't even make sense for you to still be hating somebody that ain't thinking about you. And
Mm.
when you begin to speak to people about inner healing, they shut the door. I don't want to
Yes,
talk
they
about
do.
that. I don't want to go into that. I don't want to boy. No, 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 no. Let it go. It happened. He made the mistake. You made the mistake. Let it go. Forgive them. They don't have to get a phone call. They don't have to get a letter. Just you forgive yourself for whatever mistakes you made, because that is a release that will happen in your life that will launch you further than getting your pedicure, your manicure, your facial scrubs and your facials. It is the
Mm-hmm.
inner healing that I believe will cause us, with God first, to outlive, many, if most.
I love that. I love that. And it's so true. And the last thing that I would ask is um if you could talk about the time limit to the healing and the self-care, because a lot of people would say, oh, it's your mom died 30 years ago.
Mhm, mhm.
Why is it still bothering you? Right? Uh, why are you still holding on to this? It's like, okay, we 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 got to be able to grieve, and we understand that. And you just talked about it, right?
Mhm.
But is there a real time limit, or is it on different things? Like a mom versus a divorce, a child passing versus, your father passing. You know what I'm saying? Because it's like this imbalance where, people will say, well, we have to be able to, start walking towards where we want to go. And then you have some people that says, grieve as long as you want. You know what I'm saying? And it's okay to do that,
Mhm.
right? So what do you think about that? Is it
Well, well, I definitely would have to again just say, everybody is different, and I've had to learn, really a lot. I got a long way to go, but I've
Mhm.
learned a lot. I'm a type of person, I'm wired different. I do not like to grieve long. So I categorize pain and I categorize grief in a different compartment, because
Yes.
I understand that I have a 2-year-old. I have a husband I've been married to for 27 years. I have
Hmm.
4 sons. I said 2-year-old, I got 4 sons. I
Oh,
have
wow.
a home to take care of. I'm a pastor along with my husband's a senior pastor. I'm a pastor's wife for 27 years.
Mm.
And I'm an executive director. I can go on and on about the different
Yeah.
hats. I will absolutely not have enough strength to finish my course if I'm using my course to grieve. And
Mm.
that's something to chew on.
Yeah.
You
Yeah.
can't spend
Yeah.
your course with grief. You only get
Yeah.
so much time on the earth to fulfill your destiny, fulfill what God has said. And yes, you can cash in the rest of your destiny with grief. I personally, if that's what you choose to do, to him their own. I'm just speaking about myself. That's not a good deal for me. I am obsessed with fulfilling the will of the Lord on my life. If I have to do it by myself, that's fine. So
Mm-hmm.
for me, because I am a destiny purpose driven person, I one of the things I want to do before I leave this earth is fulfill the total destiny and the will of the Lord for my life. That is something
Yes.
I choose to do. I have my own rights. I'm a human. I'm a
Yeah.
citizen of the country, and I am a kingdom citizen that's not from
Yeah.
some country. And I choose to cash in on what God said. So therefore, for me, I choose to categorize my grief. I allow myself to grieve. I allow myself to pray. But above the grief, I do what I can when people are alive.
Come
Oh,
on, Hal. I
we
was-
have some church. We about to have some church. Come on now. So I want to say to you guys out there, there is a Holy Ghost setup. What you have to understand, and again, I'm speaking for myself,
Yeah.
when people that you love, your mom, your family, everybody that is on the earth are temporal, they're going to die, including you. They gonna
Mm-hmm.
go first, or you gonna go first? We are temporary humans. We're all gonna die. I'm sorry, I hate to give you that news. You're gonna die. Yes, you were born and you're gonna die.
Mm-hmm.
So give people their flowers while they're here. Don't hold back towards your mom, sister, brother. You have that brother or sister that may be in prison. Do the best you can. Pray, send them a letter. Do what you can do while they're here. They're going to leave you. That should not be a shock to any of us.
Right.
We all have to get out of here. But for most people, they don't do right by people. They don't give people their flowers while they're here. And so they end up with a belly full of regret when mama dies suddenly, when daddy dies suddenly, when husband or sister or whatever, they did not give them their flowers. And so for them, they may grieve the rest of their lives. You know, that really might be their choice. I don't recommend that, but who am I to judge what they've been?
Mm-hmm.
So that's
Right.
to their own. It's customized for each person. But what I try to do, and I'm far from being perfect. I would be the first person to say I'm far from being perfect. I don't cross every T and I don't dot every I. But I said what I try to do is do my best with the life God gave me and manage all of the relationships around me to the best of my knowledge. And when they leave, I let them go. Now that's a word for somebody. When
For me,
they leave,
hallelujah.
ooh, Lord, we
Ah,
having a church on here. When
okay.
they leave, I let them go because I've already calculated it into my destiny that Rachel, in order to fulfill your destiny, you're going to have to count up the cost and let people go. That's a word for
Mm,
something.
it
Let
is.
people go. And because I have this wiring system that I choose to submit to, I'm able, I've had baby brother pass about, I think now about 5 or 6 years ago. I mean, like a sudden murder thing that happened. I've had
Mm-hmm.
this tragic freak accident that was 9 months pregnant and, you know, and just died on the scene in some hit and run
Mm,
DUI. I can, a brother that had just turned 40 that passed suddenly. I can go on and on. Uncles that pass and niece, another niece that just, I had a niece and a nephew passed within 6 months. I believe it was last year.
wow. Wow.
And these are young people. One was 38, one was, I think, 23. I
Yeah.
mean, to back things that you will never be able to control. But guess what? I am in 100% zero free grief
Mm,
because of how I've set up the system of wiring, being able to try to do my best when I do see people. That's all you can do. I'm telling you, that's all you can
that's
do is
right.
love people when you see them. If they're on your heart, call them, text them, send a word through somebody. They're going to leave regardless, whether you put your best foot forward or your worst foot forward. But you're the one that's going to be left with the grief if you don't do right by Big Mama or your mother. You
Mm,
don't call your mama, you don't call your daddy, you don't do right by people, you don't forgive people. And if they just suddenly die, there is a possibility you may be stuck with that grief the rest of your life because of how much regret you're dealing with, if you will.
yeah.
And
Yeah.
so I'm not here to, again, dictate how you should grieve, because that's why I said it's to him their own. I'm just telling you, for me, I have a very, very free life. It's not that I don't cry. It's not that I didn't cry at funerals and I didn't, but I promise you, and my husband will tell you this, I deal with grief differently. I choose to
Mm-hmm.
let people go because one day somebody's going to have to let me go.
Yep.
I'm going to have to get out of here too. So just
Yep.
remember this, you're temporary. And in that, allow yourself now to prepare your mental. This is Mental Health Awareness Month. This is such a
Mm,
beautiful program. Help your mental health be balanced by loving people and managing relationships. because that scripture tells us in the word of God, tomorrow is not promised to anybody. We could be here today and gone tomorrow. And I don't think people really believe that. I really don't think people believe that. But that's all you can do is do what you can do. And when those people leave, again, it is your decision on how long you want to be.
Mm. Now that blessed me because
Oh,
what I heard is love people while they're here. So when they're gone, the only
yeah,
thing that you're doing is that you have joy because you did your part.
yes, yes, and it
You did your
is.
part. You did your
Yes,
part. So why sit up here and be too busy in this and that and get caught up in all this stuff? Figure out how to heal. Figure out how to take care of yourself. Figure out how to love someone else. Because when you do that, there are no regrets.
there's no
Dr.
regret.
Rachel, thank you so much for being here.
My
Please let
pleasure.
us know how to follow you, what the church name is for those people who might be living in the area, any
Absolutely.
books or anything that you have. Please let us know.
Absolutely. So for myself, all of my social media platforms are all the same, which I'm so excited they put it together that way. And it's at Rachel M. Wilson 44. At Rachel M. Wilson 44. And you can, once you tap into that, you all of my social media platforms will come up, and you most certainly can like and share and follow us and let us know if this was a blessing to you on this awesome, awesome, awesome platform. Please let us know. We would love to get back in touch with you. And then for our ministry, my husband, I love him. I want to honor him. He's our senior pastor. I promise you, one of the best pastors on this side of heaven. I don't just say that because he's my husband, but the Lord
Right.
has used my husband to break tradition in my mindset and really help,
Mm-hmm.
because I came from old school church,
Yeah.
legalism. I came from a lot of
Yeah.
stuff that was bondage, really. We didn't know we were in bondage, but God
Mm-hmm.
used this man of God with such a powerful testimony to change my life. And our center information is the Center GSO. And if you punch that in on YouTube, if you punch that in on Facebook, it'll come right up. And most definitely, we want you to like, share, subscribe, and connect with us. We're on live every Tuesday, every Sunday, and we just absolutely love to break down, primarily my husband, the Word of
Mm.
God. Have fun doing it. We love to laugh. We are a lively church. We love God, and we have a great time. So thank you so much for that opportunity.
Oh man, Dr. Rachel, thank you so much for being here. We're gonna find something to bring you back because
Yes.
I think it was very helpful and that last piece just it just allowed me to go ahead and breathe, which is the reminder of, you know, don't be upset when people do certain things or act a certain way. If you know that time is limited here, show them love anyway, right?
Yeah,
Show them love anyway, because sometimes they know not what they do. But as
absolutely.
long as you know,
Yes.
then just give them that grace, right?
Yes.
Give them
Yes.
that grace. Oh man, thank you so much, and you have a great weekend. Okay?
Amazing time, and thank you. If you need me for anything, especially with women and mental health, I would love to be a part of that. God bless you guys
Yes, ma'am. Have a good weekend.
too. Bye bye.
Bye.